This little pill has saved countless lives. Did you know that aspirin has been crucial in preventing heart attacks by stopping clots in the arteries? However, in recent years, more and more people have stopped taking it. Why? Is it really harmless? Should we keep taking it every day? Or are there risks we do not know about? Have you ever felt dizzy for no apparent reason? When you go for walks that used to be easy, do you now feel a tight pain in your chest and have difficulty continuing? Do your calves hurt when you walk uphill? Is it possible that your arteries are partially blocked? I usually cover natural remedies for preventing diseases on my channel, but today we will make an exception to talk about a little pill that has saved countless lives. I want to clarify that I do not receive any type of benefit from speaking publicly about it, but I think it can be truly interesting to discuss a medication today. I ask for a little patience and attention. Today we are going to clarify all these doubts, answer questions about whether aspirin is for everyone, and explore natural alternatives and other medications that can have similar benefits. Also, I will talk to you about the risks and contradictions it has for health. When is it really necessary to take aspirin? What does aspirin do in our body? Aspirin is a drug with anti-inflammatory and anticoagulant properties. It mainly works by blocking the production of substances called prostaglandins, which are responsible for a series of processes in the body, such as inflammation and pain, and the formation of clots. Prostaglandins play a key role in the body's response to injuries and in the formation of blood clots, which, while useful for stopping bleeding, they can become a serious issue when they block blood flow in the arteries. By blocking the production of prostaglandins, aspirin helps prevent platelets, tiny blood cells, from sticking together and forming clots that could block the arteries. This is crucial for people with a high risk of having a heart attack or a stroke, since these events usually happen when an artery becomes blocked by a clot, preventing oxygen from reaching the heart or brain. By reducing the likelihood of these clots forming, aspirin lowers the risk of serious blockages in the arteries. This makes it an important tool in preventing cardiovascular problems. Aspirin also stands out because its anticoagulant effect works relatively quickly, which means it can be useful both as a regular preventive measure for high-risk individuals and in emergency situations. For example, many people at risk carry an aspirin with them in case they show symptoms of a heart attack, because chewing it or swallowing it quickly can help prevent the clot from becoming large before receiving medical help. In fact, clinical studies have shown that in people with a history of cardiovascular disease, the use of aspirin can reduce the risk of recurrent heart events by up to 25%. This fact has led many people, especially those at high risk for heart problems, to consider aspirin as an essential preventive resource and take it regularly in the hope of avoiding future serious events. For many years, this led aspirin to become one of the most recommended and prescribed medications for people with heart diseases. However, not everything is as simple as it seems. Aspirin is not a harmless medication, and while its benefits are clear for some people, it also has important side effects, especially for those who do not have a high cardiovascular risk. In recent years, we have learned that the risks of aspirin, such as internal bleeding and gastrointestinal problems, can outweigh the benefits in certain cases. Therefore, nowadays, it is no longer universally recommended, but it is suggested to carefully assess the risks and benefits for each individual. Why has aspirin lost popularity recently? Despite its benefits, more and more doctors and patients are being cautious about the regular use of aspirin. Why this change of approach? Well, in recent years, more detailed and specific studies have revealed that, although aspirin can be very beneficial in some cases, it also carries significant side effects that should not be taken lightly. Aspirin, by reducing the blood's ability to clot, can prevent dangerous clots, but also makes bleeding easier in situations where the body would normally manage to contain it. For example, one of the most serious risks associated with prolonged use of aspirin is gastrointestinal bleeding. Aspirin can irritate the lining of the stomach, weakening the walls of this organ and causing ulcers or even internal bleeding that can be severe or difficult to control. These effects are more common in older individuals and those with a history of digestive issues, like gastritis or ulcers. In severe cases, people who have been taking aspirin for a long time might experience stomach bleeding so serious that it requires urgent medical attention or even becomes life-threatening. Aside from gastrointestinal issues, another significant risk is the increased chance of brain bleeds. Aspirin can heighten the risk of an intracranial hemorrhage, a condition where bleeding occurs inside the brain, which is especially dangerous and often potentially fatal. This is more common in older people who are more susceptible to both the side effects of aspirin and the risks associated with falls and injuries that can increase the risk of bleeding. As a result of these findings, leading health authorities such as the FDA, the United States Food and Drug Administration, and other international organizations have begun to reassess their recommendations regarding the use of aspirin for the primary prevention of heart diseases in people without a history of heart problems. In the past, aspirin was more generally recommended for prevention, even in people without a history of heart attacks or strokes. However, nowadays it has become clear that, in those without previous cardiovascular disease, the risks can outweigh the benefits. When is it really necessary to take aspirin? Aspirin remains an important recommendation for certain people, especially those who have had a heart attack or have a history of cardiovascular disease, such as angina, or a history of strokes. In these cases, the risk of new clots forming that could block the arteries is higher, and aspirin can act as a crucial preventive tool as it helps reduce the likelihood of recurrent events by inhibiting platelet aggregation. In fact, using aspirin in people with a history of cardiovascular disease can make a significant difference in preventing new episodes, improving quality of life, and reducing the risk of serious complications. In addition to those who have had heart attacks, aspirin can also be beneficial for people with certain very specific and high cardiovascular risk factors, even if they have not had a previous heart event. For example, people with conditions like diabetes, uncontrolled hypertension, or high cholesterol, who also have other risk factors, can benefit from low-dose aspirin treatment, but always under medical supervision. In these cases, the healthcare professional might consider the risk of clots to be high enough to justify the use of aspirin as a preventive measure. For them, it could be more dangerous than beneficial. Self-medicating in these cases can lead to unnecessary side effects, such as gastrointestinal bleeding or intracranial hemorrhages, which pose serious risks. It is crucial for each person to evaluate their individual risk factors with their doctor. Could be more dangerous than beneficial. Self-medication in these cases can lead to unnecessary side effects, such as gastrointestinal bleeding or intracranial hemorrhages, which pose serious risks. It is essential for each person to assess their individual risk factors with their doctor, like family history of heart disease, cholesterol levels, blood pressure, and lifestyle. It is important to remember that every organism is different, and what may be beneficial for some people is not necessarily so for others. Natural alternatives and other medications for arterial health. Luckily, it is not just aspirin that can help us keep our arteries healthy. If you want to keep your blood clean, there are natural supplements that can be useful if you do not have heart diseases. For example, the omega-3 fatty acids found in fatty fish like salmon, sardines, and mackerel have been shown to have beneficial properties for the cardiovascular system. Studies have shown that omega-3s help reduce blood triglyceride levels, combat inflammation, and decrease the risk of arrhythmias. Additionally, it has been found that omega-3s can help reduce platelet aggregation, which is useful for preventing clot formation without the adverse effects some experience with aspirin. These fatty acids can be consumed through the diet or in supplement form, although it is advisable to speak with a doctor before adding supplements to your routine. Garlic is another natural anticoagulant that has been widely studied for its cardiovascular health benefits. Garlic contains compounds like allicin, which can help lower blood pressure and improve blood flow. Also, it has properties that promote blood fluidity, contributing to keeping the arteries in good condition. Regularly consuming garlic, whether raw or in supplements, can have a positive impact on heart health. However, people who take blood thinners need to be careful because garlic could enhance their effects and increase the risk of bleeding. Another natural option that has gained popularity is turmeric, a spice with strong anti-inflammatory properties thanks to its active compound, curcumin. Turmeric helps reduce inflammation in the body, and although its blood-thinning effects are not as strong as aspirins, it can be a beneficial alternative for maintaining cardiovascular health in people with a low risk of clots. Additionally, turmeric has been linked to improvements in endothelial function, which can help keep the arteries flexible and in good condition. However, it is important to remember that the bioavailability of curcumin is limited, so consuming it with black pepper or in more concentrated forms can help enhance its effects. Another natural method to improve cardiovascular health is consuming ginger. Ginger is known for its anti-inflammatory and antioxidant properties, and it has been found to help reduce the risk of clots by improving circulation and reducing platelet aggregation. Consume ginger in tea, fresh or powdered. It can be an easy way to incorporate it into the diet, although it is important not to consume too much, especially if you're already taking blood thinners. Green tea is another alternative with beneficial properties for the cardiovascular system. It contains catechins, which are antioxidants that help improve blood vessel health, reduce inflammation, and can prevent plaque formation in the arteries. Additionally, green tea contributes to endothelial health. Maintaining the elasticity and proper functioning of the arteries is essential. Drinking 1 to 2 cups of green tea a day can provide benefits without the side effects of some medications. There are also foods rich in vitamin K2 that help direct calcium to the bones and away from the arteries, preventing the calcification of these. Foods such as natto, a fermented soybean product, certain aged cheeses, and egg yolks contain K2 and can be helpful in reducing the risk of arterial hardening. However, people taking anticoagulants like warfarin should talk to their doctor before increasing their intake of vitamin K. In addition to these natural remedies, there are other anticoagulant medications that doctors may prescribe instead of aspirin, especially for people with specific health conditions. Medications such as clopidogrel or warfarin, among others, work in a similar way to aspirin in preventing clots, but with different mechanisms. These medications are usually prescribed when the risk of clots is high and aspirin is not suitable, or when a more specific approach is needed. However, these treatments must be strictly supervised as they also carry risks of bleeding and other side effects. Finally, it is important to remember that although these natural remedies and alternatives can be helpful in supporting cardiovascular health, they should not replace medical treatment when it is necessary. Consulting with a healthcare professional is essential to find the most appropriate treatment based on cardiovascular risk and individual needs. Final recommendations. So, aspirin or no aspirin? Throughout this video, we have seen that while aspirin has proven benefits, it also carries significant risks, especially for those without a history of heart problems. The decision on whether to take aspirin should be based on a comprehensive evaluation of your risk factors and medical history. Remember that preventive medicine is a powerful tool, but only when applied on an individual basis. For some, aspirin can be an ally in preventing cardiovascular events, while for others, it might represent an unnecessary risk. My recommendation is always to opt for an informed decision. Consult with your doctor to understand if you really need aspirin, or if there are other safer alternatives for you. Your doctor may suggest lifestyle changes, like a balanced diet, regular exercise, and managing other risk factors, which can be just as effective, if not more so, than a pharmacological intervention. Health is personal, and what may be beneficial for one person might not be for another. I want to invite you to visit our health coach at tuvisalud.com. There, you can resolve any questions you have about aspirin and other health topics that we have mentioned. Our coach is available to provide you with personalized guidance. If you found this video helpful, feel free to share it with friends or family who might also benefit from this information. Subscribe to keep getting more content like this. Warm regards. See you in the next one.